Hello, hello, and welcome to Hygiene Elevated Conversations and Innovations. Today we are joined by Mia and Nicole. And ladies, thank you so much for joining us today. You guys are fairly recent grads. You have a podcast. You have a whole lot of other fun things going on that we're going to talk about today. But first, we want to hear, excuse me, your journey to becoming a hygienist and kind of what made you guys choose what dental hygiene. So Mia, I'll have you go first, and then Nicole, if you want to chime in and answer afterwards.
So I found hygiene actually. I had actually been out on a night drinking, and a friend of one of my cousins was talking to me, and I had been telling her that I was interested in nursing and that I just didn't feel like it was for me, but I didn't know what else to go for. And she kind of recommended dental hygiene. She was a hygienist, and I think she was only 22, and she was like, "I love it. I think you could look into it, and you might find a passion for it." And I was like, okay. I looked into it. One, it had, pretty good pay that I was like, okay, I like that. Work-life balance. I do have a kiddo at home, so I wanted to be able to spend time with him. And it wasn't until I started school that I found the passion, and now it's the passion that is fueling me. So I'm really excited to continue on this dental hygiene journey.
Mia, I think you're the first person to have that revelation of a night out on drinking.
Yes.
Everybody else has had like friend or family influence. So you're the first that it was like, yeah, alcohol.
Yeah.
All right, Nicole, what is your story?
So my story is a little bit different. I kind of always loved teeth. I loved going to the dentist. I loved everything to do with it. I still didn't necessarily right out of high school want to be a hygienist necessarily. I had originally started, I was majoring in dance and just ended up, I don't know, not really doing anything with it. So then I did decide, okay, I think I really do want to be a hygienist. And I went to my local school, and it was a 4-year wait list, and I was like, no, I can't wait that long. So I went into dental assisting, and I was a dental assistant for 15 years, and then just tried to find the right time. My husband's military, so we moved a lot. We lived overseas, and it was just really hard to find time to do school, go to the physical school. So I just recently was able to do that, and it took me 15 years, but I finally got to the point that I wanted to be at, just mainly because I've always loved teeth, and it's always just been my passion, and now I get to kind of fulfill that. So it's been exciting.
Congratulations. I mean, to
Thank you.
both of you, of course, but I mean, gosh, that's a long journey and career. So you definitely do love teeth if you stuck it out that long.
Yeah, right.
Okay, I love this duo you guys have going on because your paths on how you landed in hygiene are so different from one another.
Yeah.
And then you guys clearly connected so well to be like, let's have a podcast together, right?
Yeah.
Would you guys say you complement each other the majority of the time? Like you're very opposite, but still.
Yes. Yeah, absolutely. She's so organized. She's on top of every single thing, and I'm more like I'm a slacker. So I love that. She definitely compliments me probably more than I compliment her. She's the one, that has really kind of put this podcast and this duo together, but we became friends like I think it was like day 1, day 2 of our program, and ever since we just kind of chatted about having a podcast, and then one day we were like, let's do it.
Let's see. So Mia, how far into the program did you guys when the podcast idea came to life?
I think we had actually talked about it probably like the first week. We were talking about how I saw her on social media and how I wanted to do something like that, and like we were kind of interested. Both of us had our own thoughts about podcasts, but didn't think about doing them together or anything like that. And then I think it was December, so about 7 months ago, that we decided, let's do it. Let's just do it together. She actually asked me, and I was like, yes, right away. Yes.
Because yeah, Mia, like you're like, yeah, school kid, why not add a podcast to my plate, right?
Yes, exactly. It's been good though.
Now you guys have met Joffree, right?
Yep. She spoke at our school. She was actually one of our guest speakers. And immediately I was texting Nicole while she was still talking. I was like, we should ask her to be on our podcast. She's amazing. Like, do you think she'll go for it? She's like, I'm sure she would. So I walked right up to Joffree afterwards and I was like, we have a podcast. Would you be on it? And she was like, yes, I totally would. So yeah, we were really excited. I think she was our first guest speaker. I think that you were our first one.
Congratulations, Joffrey.
Thank you. Yes. Well, now now we're gonna find out if the information I gave them was helpful.
That's true.
It is.
That's true. Okay.
So Amanda, go ahead.
No, go ahead. I was just gonna kind of go more into the podcast. So your podcast is Toothbytes podcast, and what do you guys focus on?
Everything.
So yeah, so we are Toothbytes, and we focus mainly on school related stuff for hygiene. I think the biggest reason behind the idea for me was when I was really looking for podcasts, social media, any kind of resource to prepare myself for dental hygiene school, and almost everything that was out there was based off of a traditional 2-year program. We went to an accelerated program that was 18 months and only 1 year that was actually in clinic. So for us, it was a little bit different than everything that we were kind of hearing. But there is a lot of campuses around the nation that do the accelerated program. So I thought it would be helpful to do our own version of kind of what an accelerated program as a hygiene student looks like. So that's what we started with, is kind of how we got into school, what our school schedule looks like, all of that jazz. And then we went from there into like getting ready for boards. So we did board prep. We called them quickies, and we do just like little short versions of important knowledge that you need to know for boards. And it also is helpful for us to remember and kind of go over those things. And now that we're kind of transitioning into being new grads, we're really focusing on the new type of life that we're now living and what we need, as well as the different types of other programs. So we're doing a segment right now for 2-year students across the nation. So all different kinds of schools, we're having students come on, talk about their program, talk about kind of what that looks like. So we're trying to just be well-rounded within the podcast of just being like hygiene student based. And I think now we're going to start kind of moving towards education and like professional people coming on and talking about ergonomics, different technologies, and really, what new grads should know going out of school.
I love what we do as podcasters, right? Like, we get to interview experts in our field. And I think the best education is having a podcast. Because you get an hour with a professional that is very passionate about what they do, and you get to ask them whatever questions you want. And I love what you guys are doing. I love even talking to other podcasters and hearing what they're doing. Like, I would have never thought, like dental hygiene basics, prepping hygienists to get into hygiene school, like, never even would have crossed my mind, much less being prepared for hygiene school. I guess I was a slacker. I don't know. I was just like, I'll wing it. I don't know. I'll get there. So there are just so many more resources available to hygienists. So, like, welcome to the club, guys. Thanks for bringing stuff to the table. This is awesome.
Yeah, no, it was awesome because we just wanted to put in what we were kind of trying to take out. And like Mia said, I'm very much like the planner. I'm the type A. I write out lists for every little thing. So I wanted all the resources I possibly could find. And what better way to give back than to give your own resources, which is a different view on things,
Mm-hmm. And that's the best motivation right there, right?
Mm-hmm.
I mean, I'm like the Nicole here because it was my idea to start Hygiene Elevated Conversations and Innovations. And Amanda was like, are you sure
Why?
I need another podcast?
Literally, I was like, why? Aren't there enough?
The more the merrier.
I guess so. I mean, I have not regretted it once. So, yeah.
So I would have to say between Amanda and I'm the one with all the crazy ideas, and Amanda either gives me like the thumbs up or the thumbs down on the idea. Like, let's do that or shelf that one for later.
I think Nicole's like that. She throws out a lot of ideas. I mean, I definitely have some of my own, but honestly, anything she comes up with is great. So I never have to give her a thumbs down.
You're so sweet. Thank you.
There's been very few thumbs down moments. I think it's
Yeah.
more like, let's refine that. But
Uh-huh.
yeah.
Yeah. And we were surprised how many people would be willing to come on the podcast. The first couple of times we were asking someone like you, Joffrey, or a professional of any kind to come on a lowly student podcast about hygiene school was really intimidating because we're like, oh, nobody knows our podcast. Like, why would they come on here? Especially we've had Brush with Britt on our podcast. We're getting ready to have Stephanie Botts from Polished Posture. Some big names in dental hygiene that people know. I mean, people pay to go to their lectures and they're just willing for free to come on our podcast and spend time with us and educate, students. And I was just so baffled on how easy it was, I guess, to have people that would be willing to come and share.
It's been nerve-wracking though, for sure. Just because like we didn't feel like we knew what we were doing. We were like, how do we know when one talks when the other one doesn't talk? Like, do we in the beginning we said so many times in our first episode that we had to go through and edit it out. It's been a learning curve, but I'm really excited that we did it. We've met so many like amazing people. I've definitely become even more of a dental hygiene nerd, and even become more passionate about it because of meeting so many different people who are like really great at what they do. We've talked to the relaxed hygienist, talks about burnout and all that stuff. So we're getting educated in like every single area of dental hygiene that you don't necessarily think of when you're first beginning. So it's been amazing. We've made lots of great friends and I'm excited to see, what comes from it.
Yeah.
You're right. There are a lot of really cool, passionate hygienists who are very easy to talk to and willing to come on the podcast. And it definitely shines a light on our profession of being like a friendly culture, like we're in this together, like of course I'll help you type of vibe that they're all putting out there. And I think that is really cool too. That was something that Amanda and I experienced as well. I'm thinking of like the big names we've had on the podcast, and I'm just like you guys, like, wow, I can't believe that they would sit down with us. And but they're just normal people just like us. So I agree, it is a fun experience. Let's see here. Okay, so I want to change. Let's just turn the corner here. We brought you guys on the podcast today because we really want to get down to what it's like being a new grad, stepping foot into the clinic for like, I want to say you guys are like 2 weeks in right now. So this is like prime time for this interview because I have forgotten what it's like to be a new grad sometimes, to be honest.
Scary.
It's been a decade and I remember pieces of it, but it's kind of a blur. So let's just dive right into it. Mia, how many job applications did you put out in the universe?
0. I got really lucky, actually. I'm probably the luckiest person out there. I was actually offered my position over a little beginning of December, so about almost 7 months ago. It was all about who I knew. So my best friend worked for an orthodontist office, and her boss was married to my boss. And so he's an orthodontist and she's, a dentist. And one of her hygienists were getting ready to retire. And my best friend was like, hey, my friend's in hygiene school. She doesn't graduate for a while, but I'm sure she'd work for you. She called me, offered me the position immediately. She's like, your friend's been working for us for 10 years. We love her. Like, and they had met me previously at one of their holiday parties. I was her +1. So I got to meet everybody that worked there anyway. So I just kind of had a really good way into my office. And yeah, they waited about 6 months for me. So they just had temps in there filling in my position until I was graduated and licensed and ready to start. So super, super lucky. It doesn't happen to everybody, but I'm happy that it happened for me.
Way to leverage your network.
Yeah.
You're ahead of it, Mia.
Nicole, what about you? How many resumes did you send out?
I'm pretty similar. So we had in our last semester a bunch of corporate offices come in and kind of do presentations. And there was one that came in. I kind of liked what they were saying. I just happened to look to see if they had any openings around me. And there was one across the street. So I applied because I drove an hour and a half to school each way that whole time. And I was like, I am so sick and tired of driving. And I was like, what a perfect scenario. So I applied to this one single place. I had an interview. They hired me a couple weeks later, and I actually started working there a couple months before I graduated. Just on Fridays, I would go in and do little things here and there as an assistant. Yeah, so just one place.
So what's your commute time? Like 30 seconds?
Yeah, it's 4 minutes. But
Okay.
it's seriously like such a blessing after that whole year of driving. Oh my
The
gosh.
universe giving it back to you.
Seriously, I could honestly walk there if I wanted to. I get to go home on lunch if I want. I got very lucky.
The only
That is-
downside is she has less time to listen to podcasts.
It's true. It is true.
No, I feel that. I used to commute like almost 45 minutes every day for work, and I'm 4 minutes from my work now. And yeah, you don't have time to listen to podcasts. Now I have to
Yeah.
clean.
I'm lucky if I get a full song in, so
Yes.
Okay, I'm thinking that first day, that first patient, that was so fresh for you guys. Nicole, walk us through. What was that first day like?
unplanned. So again, weird scenario. So in my office I have a mentor and she is wonderful. I love her. She's been really helpful. I shadowed her for many weeks until my license came in. So first day, I went in and I was not expecting or planning to see patients. They were still trying to put my column together. It hadn't been filled. And my mentor basically told me 5 minutes before the day started, you're taking my column today. And I hadn't cleaned anybody's teeth or seen a patient in about 4 months from the time that I started and graduation and all that. And I was like, okay. I didn't get a chance to look at any of the patients, prep, nothing. So it was rocky. And then she was standing over me most of the day. So I'm just like trying to figure out everything I was supposed to do. And I ended up, dropping a Cavitron. I dropped a saliva ejector. I couldn't stop the water flow in someone's mouth. I probably sent all the wrong insurance codes. I had a man who was unable to bite down on x-rays. He was just really struggled with it. And it was the first FMX that I was taking. And like I said, I've been an assistant for 15 years, but she's looking at me and she's like, can I show you maybe some tricks on how to take x-rays? I'm like, girl. And then he was licking the iTero scanner. So she thought I didn't know how to scan. So it was a pretty rocky first day. And then she sent an assistant in to teach me how to scan. And I whipped that thing out in 2 seconds. I said, it was the patient. It was not me. So yeah, it was an interesting first day. But then after that, I was okay.
Gosh. Trial by fire.
I guess so.
She was thrown to the wolves.
Yes, I
That's
was.
what it sounds like.
Absolutely. But it's okay. I grew from it, I guess.
Mhm. What about you, Mia?
I am a nervous Nelly. I am nothing but anxiety bundled into this body. That is just who I am. I overthink every single thing. So I was scared. I mean, I was freaking out on my way to work. I was like, I don't think I could do this. What if I suck at it? I don't know what this day is going to be like. Can I even do a 1 hour appointment? I don't know, because our fastest appointment in school was 2 hours. And so I got in there and I attempted to look over notes, and I very quickly learned that not every hygienist does notes like we were taught to do. And so it was very hard to follow what this person had really had done, what they hadn't done. I didn't even know how to get to their medical history. It was a bit scary. I mean, I did make it through the day, but I remember leaving being like, I messed up. Hygiene is not for me. What if I can't do this? I'm not good at this. I'm slow. There's just no way. And now that I have finished the second week, I definitely have settled in and I found my routine and I found a lot of my speed and I feel a lot more comfortable doing it. But that first day I was like, have I ever even scaled a tooth before? I mean, I don't think I've ever used any of these instruments. I don't know how to adapt. I just felt like I felt like it was day one in clinic, the first time we ever saw a patient, and had no idea what I was doing. And then I have told Nicole this, I felt like I had this really large, loud clock in my room, just tick, 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 I felt so stressed and pressured, like 1 hour, the doctor needs to come in here soon. And I'm just now scaling and oh my gosh. I mean, thankfully I only ran, I think it was like 10 to 15 minutes behind, depending on the appointment. So I wasn't like an hour and a half. And the only reason why it took an hour and 15 was that was with like cleanup and setup for next patient too. So it wasn't terrible. I've gotten a lot faster since, but that first day or that first week I was on the verge of crying on my way to work because I was like, I can't do this. It's too scary. And I don't know any of this stuff. I don't know how to do insurance. I don't know any of that. It was definitely terrifying, but for anybody that's listening, you can definitely get through it. You can do it. If I can, you definitely can.
Yeah, I'm just thinking, but did anybody die?
No.
But did you die though?
A couple people got poked, like I accidentally jabbed somebody in the tongue with a Cavitron tip because it wouldn't shut off. And I was trying to like hold it over her mouth while I'm like trying to figure out like what cord do I need to pull to make it stop? The button's not clicking. Like, I don't know what to do. And, I was like, oh my gosh, I'm so sorry. I just poked you in the tongue. Like, I just felt so embarrassed. Like, I guarantee every single patient I saw that first week was like, she's a noob. She's new. I know she's new. It was stressful.
I think, I told you I can remember bits and pieces of being a new grad. And one of the things I remember is completely pretending like I had been doing this forever.
Mm-hmm.
Like, I did not tell anybody I was new.
Yep.
That's
like what we've been doing.
That's the most Joffree thing you could have ever said. Like, Joffree is a great bluffer. And I mean that in a positive way. There's many a story if you listen to the podcast where it's like, I've never told them I didn't do a double hygiene. I just told them I could. Like, you never did.
I remember that story. But I mean, it's true. That was, I don't know if it was you or somebody gave it. I think it actually was you that gave that piece of advice to us in class, saying, don't ever tell somebody that you're new. Like, don't tell somebody that you're right out of school. So anybody that has asked me, are you new to the office? I always say, I am new to the office, but I've been in dentistry for 15 years.
There you go.
There's no lie there.
There's no lie there.
Exactly. It's all about how you say it.
So we've been telling our patients, like, if they ask, because like I'll tell them I'm new to the office and they'll be like, oh yeah, where did you work before? And I'm like, oh, I actually worked down in Aurora. Oh, how long have you been a hygienist? I've been working in hygiene for almost 2 years now.
Yeah,
like,
count your school time.
Like they have no idea. But I mean, sometimes when an accident, like poking somebody in the tongue, I'm like, I promise I'm not new. I'm not new.
Yeah, it's like even when I temp now, if I were going to temp, which I don't like to do, but if I do and I don't know how to work things in the operatory, I'll tell the patients, oh, I've been doing this for a long time. I've just never done it in here before. So give me a minute to figure out this chair.
It's like driving somebody else's car. It's, it's,
yes,
you don't know how good the brakes and the pedals are.
Yeah. Yep. I tell patients, like, if I'm temping, like, I know what I'm doing, just not how I'm doing it.
That's a good way to say it too.
Yeah.
Okay, so what has it been like being the new person on the team? Mia, how has the team embraced you?
I was really nervous because the hygienists that I work with, they all have been in the field for a very long time. I think one of them, it's like 23 years. The other ones are like 33 and up. So they've been in it for a long time. There's one of them that's been working just at that office for 25 years. So I'm the noob. But they really have embraced me. They are totally there to help me. I thought I was going to be, because, I've heard some horror stories that when you very first start, especially like as a brand new hygienist, if you're going to be with a lot of experienced hygienists, that sometimes you kind of come in and it feels like you're stepping on their toes and they might be a little bitter towards you. They have not been towards me at all. They have definitely helped me anytime I have a question. Yeah, I feel like I fit in right away. And, in other jobs that I've had in the past, it takes a good while for you to feel like you're a part of like the work family, but I feel like I'm getting right in there right away. So 2 weeks in, and yeah, I'm having a good time. They've definitely embraced me. I've actually had some of them ask me about, staging and grading because they don't understand it. They're not used to it. So they want me to maybe do like a little lunch and learn with them and teach them what I know. So that way maybe we can start adding that into their notes. And so it's really nice that they're asking me questions and they're constantly asking me like, is there anything that we could change? Anything that we can do? Remember, like you just got out of school, so you're more educated than us on all this new stuff. So please, anything that you see or notice, like let us know and we can make some changes. So it's been really nice.
Oh, that's so good.
Yeah.
What about you, Nicole? How has your experience been being the new person on the team?
So it's been pretty good. I'm one of 7 hygienists. So, like I said, it's a larger office that I'm at. Most of the people are my age, which is really nice. And I had a mentor. So I had someone that specifically was dedicated to helping me integrate into the office and to being a hygienist out of school. So it was really nice. And I've developed an amazing relationship with her. And we have a great hygiene assistant that does my nails outside of work. And we've gone and done lunches. So I feel like kind of getting a part of the team, I feel really comfortable with that. I kind of went in with guns blazing, though, on several issues that I had with the way things were being done in certain ways, the way that laser was being done for SRP patients. I had like a sit down with the doctors about it and was like, your hygienists don't even know how to do, this for this technology. And I tried to do it as like respectfully as possible, but basically I just brought to their attention my concerns and the way that I wanted to do things. Because what had attracted me to that office was they were like, you have your own room and in your room you practice how you want. And so I was like, okay, well, this is a more proper way to do laser for this. And then the following week I had a big talk with them about their medical history with such a large office. Everybody was doing it different and things were getting missed. And then this week I had another sit down with them about how, the saliva ejector is not a proper excavation tool for saliva while using aerosols. And so we had a big talk about incorporating maybe a relief or an isolite, something that was more OSHA compliant, ergonomic, and better for the patient. So I've been a little mouthy, but I've had support from all the hygienists. I've kind of talked to them on the side. We have a group chat that they didn't have beforehand, and I suggested that. So I kind of feel like I'm sort of changing things, but I've tried to do it respectfully. And so far, everyone has been really kind about it. And they haven't been like, who is this girl? Get out of here. They've been like, all right, yeah, cool, let's do it. And I don't know. I feel like it's going pretty well.
I remember being the new grad, being just shocked that they weren't taking blood pressures.
Yes, that was part of our meeting too.
I'm like, I want a blood pressure cuff. And they would always ask me, Joffrey, can you come down for the doctor? And I'm like, yeah, did you take their blood pressure? And no. I'm like, okay, we'll take it and then come get me. And so looking back though, I feel very like proud of myself for saying, hey, we could be doing this better. And this is actually standard of care. I really had the mindset like I was never going to do something that was below standard. And when I had said that in the like staff meeting, they were like, oh, good point. You can have a blood pressure cuff.
Right. Yeah, they don't like when you point out stuff like this is below standard of care or this is not OSHA compliant or I don't know. I had seen somebody that was taking amitriptyline and they were giving this patient epi every time they came in for anesthetic. And that was one of those things that was drilled into my brain at school, like no epi, no epi, no epi. And I showed that to them and they were like, oh, but same thing, no blood pressures. And so I brought my own cuff in and started taking it I was like, you know what? If nobody else wants to do that, that's fine. I'm not pushing for change for everyone. I'm just telling you what I am going to do as the provider, because I'm going to provide what I feel is the best care.
Mhm.
So I'm curious, Nicole, with the leeway you have, like this is your operatory, you can practice how you would like. Do you get to have some say on what you want? Like, for example, if you wanted to introduce salivary testing into your operatory, is that something the company would support?
I think it's something, the way that they made it sound to me and how it's been so far is state your case. So every Wednesday, our doctors have a meeting during lunch where they sit in like a conference room. And if you have something that you want to incorporate, you have to state your case. You bring your research, you bring the paperwork for the doctor, the product if you have it, which is what I was doing for the relief to try and get that introduced. So I think it's something that, depending on what it is, if the doctors are on board, that they're cool with it, especially if it's something like salivary testing that, requires a little bit of money and like change in insurance, things like that. Because like with the laser, I'm trying to incorporate the laser assisted periodontal therapy. They're really just mainly using the laser bacterial reduction right now, which is great, but it's not really meant for, SRP patients. It's really meant for like gingivitis type of stuff. So I was explaining to them how that can actually increase their revenue, because you can do more of a by tooth sort of payment rather than full mouth. So I think as long as you're bringing that to them, if it's going to cost something to order, they seem pretty open to it, as long as you're explaining to them why you're doing it. That's what I've seen so far. But like, we have a girl in our office that she practices very holistic. She doesn't believe in fluoride and things like that. She still does offer it if patients would like, but that's kind of what they are like, you can sort of promote what you want and not what you want, kind of thing.
I like that. And it sounds like it's great that they're even like entertain the idea.
Yes, yeah, and I appreciate that they respect that, and I feel like that is one thing too that I've noticed. Switching from an assistant to a hygienist is like an immediate jump in respect in the office, and I feel like that's not talked about a lot. But I was an assistant for so long that, assistants get treated like crap, and they just get like dismissed often, like, you don't know what you're talking about, whatever. And I felt like when I came in as a hygienist, like my doctors and my fellow hygienists, I would say something, they respected what I said. They were like, oh yeah, like absolutely. And so that was a big like wake up call for me, is just with the change in respect in that way.
Well, let's talk about that for a second. So what are you doing to change that up, Nicole? Are you going out of your way to make the assistants in the office feel more respected than you did as an assistant?
So I mainly like, so our office is so big that we have a whole section of doctors and their assistants. And when I see them in the hallway, I definitely talk to them, and I've, created a relationship with them, but I actually don't see a lot of our assistants throughout the day. I do see our hygiene assistant, and I always talk to anybody like how I want to be talked to. I don't care if you're a doctor. I don't care if you're a plumber. I don't care who you are. I'm going to talk to you like a person. I don't feel that, education makes you any better or less than. It's all about what's in your heart and what kind of person you are. So of course I still talk to, all of the assistants in our office, and I try and help them, because I think it's also ingrained in me to just be in the lab and like, okay, let's switch over the ultrasonic, let's take out the bags. And there's such a whole, thought of diva hygienist. She can't, switch over her instruments and stuff like that. And I don't ever want to be that way. So I still, at this point, and always, I want to help in any way that I can. If I see an assistant drowning in the lab and I'm sitting here, twiddling my thumbs, I'm going to jump in and I'm going to help them. So I just, it was just eye opening, I guess, to see that nobody questioned me when I said something when they questioned me before. You know what I mean? Does that make sense?
Yeah. So Nicole, you've got a very large office. I mean, 7 hygienists, that's massive. Nicole, how many hygienists are in, or sorry, Mia, how many hygienists are in your clinic?
Technically 5, I think. No, maybe 6. But it is small. There's only 2 hygiene ops, but it's because I work Monday through Thursday. So I'm the full timer there. One of them, they're all very seasoned in hygiene, so they have a lot more seniority over than I do. And so one of them works on Monday, only. And then one of them works Tuesdays and Wednesdays. And then one of them works only on Thursdays. And then Saturday, there's a hygienist that works 4 hours every week. And then there's one that will work one time per month on a Friday for 4 hours. So in all reality, there's only 2 hygienists in the office at a time. But there's a lot that technically work there.
That's interesting. Nicole, are all of your hygienists like everybody's full time?
All except for one. We have one older lady that only works Friday mornings, and then she comes in, I guess, as needed. But the rest of us are all full time, and they're actually hiring 2 more right now. So,
holy cow!
I'm so curious. How many operatories are in this office?
So, it's honestly the biggest office I've ever seen. It's a 2-story office. It's kind of like a V. So when you walk in, you have your main, your lobby, which is divided into 2 sections, and the business area. And then there's 2 wings that jet off. And so one wing to the right is strictly dentists. There's 10 ops on that side. And then the other side is mainly there's like one doctor that works out of one op, but it's another 10 just hygiene ops. So there's 2 wings of the office. So 20 ops pretty much all together.
It's huge.
Good night.
Yeah.
That's crazy.
It is.
That's a lot of people to know.
That is a lot. Like,
yeah, I still don't know everybody's name, and I've been there since March.
Yeah. No.
There's 27, I think I heard last, 27 employees all together in the office.
Oh my gosh.
Wow, I can't. Wow.
I know.
And she's over there teaching all of them.
Schooling them up.
Well, I like it. Gosh, that's so big. I can't imagine.
I know. That's like the dynamics. Like if you had if this was old school and you had like 7 diva hygienists, oh my gosh.
Yeah.
But it sounds like both of you have really great, healthy working environments.
For now.
Yeah, for now. I mean, 2 weeks in, I think, Nicole, you would probably have felt pushback already if you weren't.
Yeah.
Interesting.
Okay, so if you had to say like one thing that the office offered that you like, what was the reason that you were like, this is the one, like that of like a job benefit or a perk that they put on that was offered to you? Like, what kind of sealed the deal? Mia, let's hear what you're thinking.
I think maybe because I had met them before, and when I spoke with the doctor on the phone, the day that she was offering me a position, everything she told me sounded great. The pay, I mean, most dental hygiene jobs, you don't typically get like insurance, which I was like, it is what it is. I just want to get my foot in the door and get comfortable. I can always change something later. I'm not worried about that at this time. The pay was great. My friend had worked for my doctor's husband for a very long time, and they had really good employee retention. People had been working there for a very long time, and they had even told me that like best offices ever. So everything that she had told me during the phone call, I even spoke to my instructors about, and one of them was like, that is probably the only job that would make me go work back in a private practice. She was like, that's what would get me back into the clinic, is a job like that. That's basically a unicorn job. And I was like, okay. I mean, I have a hygiene assistant. It's just, I have a single column, and they are staggered. So we never need the doc at the same time, which is amazing. She's super, super friendly. I know sometimes, female doctors can be a little hard to work for, but she has been amazing, constantly checking in on me, telling me that I'm doing a great job. So really, I mean, everything just sounded amazing, and it was close to home. I wanted to move back to the northern end of Colorado, and they had offered me the position. And so I just was like, yes, I'm going to take it. You just never know what you're going to get for your first job, because you don't know what to really expect. People can try and warn you all they want about what to look for and what to stay away from, but you have no idea until you start working. And so I just was like, let's do it. Everything sounds great. I had shadowed the office before I ever started, before we even did any paperwork. And I still was like, yes, I like the way that they do things here. I mean, every office has a couple cons. They all have it, right? So
Right.
I was like, yep, I'm all in. This just seems like the one. She's really supportive. They really do a lot for their employees, and they do like team appreciation days where everybody gets paid to go do something fun. And it just seemed like a really good fit for me.
Aw.
I like that. It sounds like they really value the culture, and that's what's building that retention.
Yes.
Let's see, Nicole, what are your thoughts on that? What was something like? How did they seal the deal? What did they offer that you were like, this is the one?
Well, like I mentioned, it was across the street, so already that was kind of a really important thing for me. But what I really liked was the flexibility that they offered, such as, it's your op, you practice how you want. That was kind of like, oh, okay, no one's dictating me. Another thing that they said was I am in charge of my own schedule, which I'm finding is a little bit different even for hygienists, but I can pick and choose my days completely. If I decide one week I don't want to be there Tuesday, Thursday, then I close out Tuesday, Thursday. So I have complete autonomy of my own schedule, which was really appealing to me because, again, as an assistant, I was always expected to be at the office when the doctor was there. There was no choice. If you wanted to take off, you had to, ask for the time off and explain why you had the time off. And then you had, all that stuff. So I really liked that I could pick and choose my schedule as I wanted to. There is also like the flexibility. If I would like to do accelerated in double column, I can. So it's kind of like there's ways to grow. And because it is a corporate office, they do offer, such things as mentorship and things that you can actually go up in the ranks rather than just, staying stagnant in one position. If you wanted to look into being a manager, you have the option to do that. If you wanted to, be a temp hygienist within all the sister offices, there was just a lot of flexibility and a lot of openness. And it was a lot of you choose what you want out of this experience. And so far it's held true. So I'm hoping that that continues to be the case because that flexibility is really what appealed to me the most.
Mm-hmm.
That definitely resonates with me. Like that flexibility. Oh my gosh, that means so much. I have worked in offices where it was expected when the doctor's out, you're taking that time off too. And it was very frowned upon if you took time off outside of that. And it was like, because I have a life outside of your life, like, I'm sorry. So all those things that you just mentioned, Nicole, are, I think it's currency. It's not just money, it's currency. That flexibility means a lot.
Yeah, absolutely. And even like we had an office renovation for 3 weeks, and instead of being like, oh, yeah, you can't come in, they're like, well, there's not much you can do, but if you want to come in and clean, that kind of thing, they still gave us like options to come in and make our hours. And I've never worked corporate prior to this job. I've always worked for small private dental practices. And so it's cool to me, too, that if there's ever like an issue, you have someone to go to because you hear those horror stories about like, doctor's not paying, or they're telling you have to clock out for lunch and stuff like that. But in a corporate position, they have to follow the rules, and they do follow the rules. And if there's a problem, you have higher ups to go to rather than just the doctor that screwed you over. You can't really go to him, you know what I mean?
Yeah. Okay, I'm curious about the pay models in your guys' office. Let's hear from Mia first. But Mia, is your office like, is it hourly? Is it a collections, a productions pay? Are there bonuses? Like, what type of pay are you getting in your office? I mean, don't tell us the dollar amount, but just the
Yeah.
stat.
I'm getting hourly, and I don't have to clock out when I don't have a patient. So I get to just hang out and either sharpen instruments. I try to help the assistant if I can. I mean, I'm new, so I'm having her teach me this stuff so that way I can help her in the future. But yeah, I'm just getting hourly, and she's not like big on like pushing patients to purchase products. I mean, you can try if you want to, but she's had this client base for so long. I think it's been somewhere between 25 and 30 years that she's had her practice. So she knows every patient. She doesn't believe in forcing them to purchase certain things if she doesn't think that they need them. she really doesn't want to make it like that. She wants her patients to feel really like comfortable and at home there. And that way they feel comfortable. If they have, questions about their teeth, like they want them more white, then they can bring it up. She's never going to push on it. So I like that, at least for, my first job. I don't really want that extra pressure of having to try and like sell my patients a bunch of stuff in addition to, trying to get things done in an hour and learning the system and just trying to figure out how to get an FMX and a cleaning done in a visit. Like, yeah, it's really nice, but I like that she's very patient centered. And so, yeah, right now hourly, I wouldn't say, as far as I know, I don't think that we do bonuses. I don't know, but they're really good. So at the holiday parties and stuff, you get a +1 that goes. They usually like rent out like a casino, have all of it catered, and then they'll get everybody like hotel rooms, and they will even give you and your +1 like $100 chip, and you have the ability to either gamble that $100 or go cash it out and just leave with $100 just for going to their holiday party. And so, they do a really good job at taking care of their employees. So I'm not bummed that I don't get bonuses. I'm okay with my hourly, and that's good for me.
Okay, Mia, I can't wait to see these holiday party photos on your social media. The holidays
for
will
sure.
come. We're already scheduling 6 months out in December, so
Yeah,
Okay. It's gonna be fun.
Nicole, what about you? What's your pay structure like?
My pay is hourly, and we do have a bonus system. So if you make over $12.50 in a day, you get 5% of that. If you make over $17.50 in a day, you get 7% of that. It has been a little difficult to make that, but again, I'm kind of not really seeing a lot of the hard hitting stuff quite yet. So we'll have to see. I feel like a lot of times that's really achievable if you're doing an accelerated column. So that might be something I look into in the future just to try it out and see what it looks like. I actually had to accelerate a patient yesterday because we had a hygienist go home for an emergency. So that was interesting. And then we offer they have really good 401k options. Health and dental obviously is taken care of. So they had I think because it is corporate, they're able to do that kind of thing, but they have a lot of benefits in that, and having, the insurances and stuff. But they also do pay for all of our CEs, and they do frequent meetings like communication and team meetings where they have several offices come together. Like just this past week, we had one, and it was almost like a field day. They put together all these like activities. We were outside in our shorts. We all had matching t-shirts, and we were playing games with like balloons and, playing water balloon stuff. So they do a lot of like team outing events and team building, and they don't make you clock out for any of that. So you're getting paid for all of it. They do this big meeting, I think every 1 or 2 years, where they send everyone to a city. They pay for everyone's flights, hotels, and it's a weekend of CE. So I feel like to me that's good stuff. I love anything that's like team building. That's always been my favorite in an office. So that's a bonus to me.
And I would imagine too, with an office like of 27 people, I think you said, I think that is pretty important to like create that cohesive structure. So you're not feeling like such like, oh, that's the dental assistant side. Oh, that's that. So yeah, I think that team building for such a large office is very smart and a very good investment on their part.
Mm-hmm. I agree.
Okay, so I'm curious, Nicole. It sounds like you have your eye on something other than just being in the clinic, whether that be growth within a corporation or I don't even know, but I have a feeling that you have your eye on something. So I'm just wondering, what is it?
I don't really know yet. So I'm active in our ADHA component here in Colorado, and I'm the alternate director of our southern region down here. And our current director is trying to step away. So I'm trying to go into her place and take over a little bit of getting people together hygiene wise in the southern part of Colorado for the CODA. And, I also have my social media where I'm trying to just share very real what life is like as a student and now as a new grad. And we have our podcast. So I feel like I have my hand in a couple different options. So I really eventually would like to get into speaking. I really do want to get into, maybe teaching a CE course. I think my dream is to be able to, go to these conferences and not be the one in the crowd, but the one on the up at the stand. And I want to educate people. I don't want to be a teacher. I don't want to teach hygiene schools, even though it kind of sounds like I do, but I don't. I want to do something a little bit more non-school related and be able to, do something along the lines of writing and speaking, I think.
I think you're on the right path.
Oh, thank you.
What about you, Mia? And what does the future look like for you?
Oh, I have no idea. For right now, I really just want to get comfortable with, being a really good hygienist. Like being 100% sure that my patients are walking out of that door way better than when they walked in. Like I want to make sure that they feel that they can trust me, that they want to come back. I want to establish, a really good rapport with my patients and get to know this large patient base that's been going there for a long time. In the future, I don't know what I want to do. Me and Nicole have toyed with an idea. I actually told her when we very first started and we were both kind of like venting about our experience for our first week that like it would be really cool to like start your own practice and make it to be like the best place a hygienist or an assistant has ever worked and format those appointments based on like the need, right? So like maybe an hour and a half for certain types of appointments instead of an hour for a prophy. Like give them an hour and a half to really be thorough and do all that stuff and make them never feel that panic of like, oh, I'm running behind. But it gives them a little bit more of a work-life balance even while they're working, So we played with that and we kind of joked and said like maybe we can one day own a practice together because in Colorado you can. I don't know. We'll see what happens. I'm not brave enough to be a speaker like she is. I'm going to leave that to her. I have toyed with the idea of one day being an instructor. I wouldn't necessarily want to do like the lecture portion of it because I don't want to be grading papers because, I don't even want to read my own when I have to write them. But I would be okay with being like a clinical instructor. Like I really want to be, if I ever choose to go that route, I want to be the instructor that everybody can ask their dumb questions to. When you are embarrassed and you're like, I don't want to ask them this. They're going to think I'm stupid. Like, I should know this, right? I had lots of questions I should have asked when I was in school and I didn't. And I also never felt brave enough to ask my instructor to like hover over me and watch me scale for a few minutes, like when I was using, just hand scaling. And I wish that I would have done that, but I want to be that instructor that they trust and feel comfortable and being like vulnerable with me. And I really want to take the time to give back to them and make them truly feel like they're going to succeed. Because I mean, we had great instructors, but I never utilized it. I didn't ask them. I was too nervous. Like I said, I'm a nervous Nelly. So if I ever decided to go that route, I'm going to make sure that I'm like the best teacher ever.
I love that.
Mm-hmm.
And not that, and I want to clarify. I asked that question because I know you guys pretty well and I know you have big ambitions. I think it's totally fine for hygienists that want to just stay in clinic. Like that's totally fine and respectable too. Like that's what
we went to school for.
Yeah.
Right.
So I just know there's a little spark in you guys to do something else.
Yeah.
Well,
I think it's
nice
because
thing
we dipped
about
our
it.
toe in it early. We dipped our toe in
Yeah.
what else a hygienist could be a little early, like before we even got licensed or even graduated. So we got a taste of that there's a lot more out there. I don't think that I knew any of that before I ever even started the path to hygiene. I thought once you're a hygienist, like you're literally cleaning teeth and helping people all day long in a clinic until you one day retire. I didn't know that you could be an instructor. I didn't know that you could be a speaker. I didn't know that you could do CE courses. I had no idea that that there were so many options. So I think having a podcast has really opened our eyes to the different directions that you can go. And it makes you feel like even a year from now, if I decided to not work in the clinic anymore, that I have so many other things I can do. And that's really nice. It makes you feel really hopeful.
Yeah. I like that. I'm curious, what areas in dental hygiene are you guys most interested in when it comes to like continuing your education, or if there's something you want to specialize in? Mia, is there anything that has caught your attention?
Um, I don't know. There's been a couple things I've been seeing lately. I recently saw something that Brush with Brit had talked about like hygienists working in like an OBGYN office, like taking care of, pregnant women and their oral health. And I didn't know that that was like a thing, but there are some offices that have a hygienist that works at their practice just for hygiene or just for cleanings for pregnancy, because pregnancy gingivitis and stuff. I think it's
What a cool
really,
idea.
yeah. And then that there's the possibility that one day we can do Botox, and I don't know, there's just a lot of stuff. But right now, like, continuing education courses that I'm really interested in taking are like advanced instrumentation, really learning about like myofunctional therapy and screening for oral cancer, because yes, we learn about it, but when you're out of school and you're not immersed in it for 2-3 months or however long in between, you're like, I forgot what that's called, or I forgot. And when you're in a hurry, you're kind of like, no, everything looks good. And I don't want to be that person that misses anything. I want to be the person that if my patient has something, I want to catch it and make sure that they go seek the help that they need for it, and make sure that it's either, okay, and that it was nothing or, that it helps save their lives, so yeah.
What about you, Nicole? Is there a special category like you're eager to learn more about?
So I really like learning about probiotics, like BioGaia's whole situation. I really love like holistic, like herbs and ways that we can help fix things without doing like hardcore medicine. But I also believe in like the dental medicinal integration. Like Mia was saying, having a hygienist in an office, a medical office, or having like a medical office with a dental office combined. So, if you're getting high blood pressure readings or something else is going on, you can just bring them right next door and have a doctor come in, or something that, and I know that's coming in the future, that integration with both fields, like it should always be. And I think it's really interesting too, that kind of coincides with having the probiotics like BioGaia that decreases the bacteria from periodontal disease. That really interests me, because learning more about how periodontal disease and the bacteria that causes it also causes heart disease. It causes, what is it, Alzheimer's. And I was telling a patient that the other day, and she was like, "You've got to be kidding me. My mom has Alzheimer's. She also has periodontal disease." So it's like when you're able to tell these patients and they're like clicking in their head, it's just such a cool feeling. So I'm really have always been very interested in periodontal and just kind of different things that you can do to support your immune system and support reducing that bacterial load, but then also helping the patient to be educated and understanding, the correlations between our oral health and our systemic health.
Mm-hmm.
I love it.
So beautiful. Gosh, you guys are so inspiring. Like, I love listening to you guys and your responses. Like, it's so refreshing that you guys have these like fresh eyes on things and this just new perspective, and you're just diving in head first into this whole new world of being dental hygienists. And you're doing a phenomenal job, by the way. You made it past day one. You're gonna just be stellar now.
Yeah, we got past the scary day, so we're good now. We're good. We made it through.
I think the fact that you guys are already thinking about your CEs instead of saying, forget it, I just graduated, I don't care about CEs right now, says a lot about you. Because yeah, I was definitely like, I don't care, I'll figure that out in like 6 months.
Yeah, we're doing one tomorrow morning. Like, we're waking
Oh
up
my
to do
gosh.
a CE course. I've already done one a couple weeks ago.
Mhm.
I mean, I think there are a lot of them that I have already gone to. I mean, they didn't count towards our license back then, but they were really like eye-opening to a lot of stuff. I went to one time where it helped you like identify the signs of abuse, and there were so many things that you kind of like, yeah, you can see a black eye, like that would be normal, and kind of ask them, like, like, what happened, or try and ask any questions about that. But there were so many other signs like the cheekbone being lower than the other one. And that just means that maybe they've been having it for a long time. It's been something they've been kind of having to endure for many, many years, and no one knows about it. No one's ever asked them about it. And I don't know. It was just really eye-opening that, like, dang, there is so many other things that I could be doing. I'm not just cleaning these people's teeth. And like, I knew that we were educating them on, nutritional needs and like how to take care of their teeth, things that they didn't know. But there are so many more like things that I can educate my patients on or help them in other ways that I didn't know I could do before I went to dental hygiene school. So I'm excited about CEs because we're new, and the more I can learn now, the more I can implement later.
Nice. I like that. Let's see. I'm curious, Mia, what is your favorite instrument so far?
Oh, my favorite one ever is actually the Jack Be Nimble Slim. That's my top. I love it. I mean, before that, it was the Nevi, though, because we had like a basic set of instruments, and that was my favorite. But I purchased some with a student discount right before graduation just to kind of learn some other instruments. And I swear I could probably clean an entire mouth with just that instrument. Like that, it's the one, it's a chef's kiss.
I love it. Amanda, what's your favorite? I've never even asked you this.
Oh, like we haven't gone there yet. No, a Nevi. Honestly, I love a Nevi. I'm a universal. Like I have Gracie's, of course, but 9 times out of 10, it's gonna be a Nevi. What about
Nicole,
you?
what about yourself?
Same, honestly. I love my Jack Be Nimble Slim. I love my Montana Jack. I love my Nevi. I mean, it's just a beautiful instrument.
Yeah, I'm a sickle girly, man. Like I really think you can give me any sickle and I'll be like, yes.
Yeah,
She's so pretty.
I can clean
She's
them out.
so pretty.
yeah. Are you team sickle, Joffrey?
Yeah. Okay. My favorite 204S.
I do like the 204S too, yeah.
Oh, it cleans a premolar so good.
Yes.
Mm-hmm, it does.
Get right in between those lower anteriors perfectly, where my maybe my more popular scalers might not be super sharp anymore, but that 204S will always get in there.
Yeah.
Always.
Every time.
I guess that comes second to the Cavitron, though.
Well,
Okay,
yeah. Just pull
goes without saying.
Yeah.
Yeah.
Cavitron. Okay, I should have said number one. Cavitron.
Yeah.
It was assumed.
Yes.
It was
Cavitron is Bay.
Yeah. Okay. So we always close these podcasts with the same questions, and we're going to have to tweak them just a smidge since you guys have just finished school. But okay, in your 2 weeks of practice, what concept have you learned that you're like, I can't believe I didn't learn this in school? Whoever it feels ready to go ahead and let us know what your thoughts are.
My biggest one was honestly a pretty big mistake that I made with insurance. And it was not realizing that you couldn't do a full mouth SRP in one day. I haven't had any patients that have really wanted an anesthetic with their SRPs. And I had a man ask if he could just get it all done in one day. I had no idea that was an issue. So I said, sure, why the heck not? Did his whole mouth, walked him out, and the front desk was like, what did you just do? I said, oh, he can't come. He's busy. He can't come back. They're like, no, the insurance is not going to pay for that. And I was like, I'm sorry, what? And they're like, yeah, we're going to have to write that off. And I was like, oh my God. So that was a concept I did not know and now do. So
that actually, Nicole, so that is something that when our front desk is verifying insurance, like that's one of the questions they ask, because there are some insurance that do.
Okay. That's good to know.
Yeah. So that's one of their standard questions is like, do you pay if we do full mouth in one day? Like, is that allowed?
I have to see if they can't get that maybe I don't know, more calibrated, because I don't even know where to look for that kind of information, nor did I know that was even a thing. So
yeah, they have to ask.
Okay.
They have a whole sheet whenever they're calling, and they have specific codes. But with SRP, that's one of them that my office asks is that allowed?
Okay.
Nicole, I actually had a very similar experience as a new grad with insurance and SRP, and that was I had enough time to start one quad. So I did the one quad. MetLife will not cover just one quad at a time.
Oh.
So yeah, that one quad I did was not
Also good to
covered
know.
by that insurance.
Yeah.
Any other insurance would have been fine, but that one. So anyway, you're gonna learn these kind of things forever. Those types of scenarios are never gonna go away.
Nuances.
You always remember them, and you just don't make that same error
Yeah.
again. Like hygienists are just so good at acclimating and like retaining and going with the flow and stuff. Like you'll be like, oh, we're not doing that again, and it won't ever happen again. Like,
Absolutely.
what about you, Mia? What's something you were like, I can't believe I didn't learn this?
I would probably say the same, because I know nothing about that. So even just figuring out if like fluoride is covered for this child that I'm seeing, like I have no idea. So I didn't know the system, didn't know how to access any of the documents to even try to read over them, didn't know how to read them. I do think that there should be a class in dental hygiene school, like the last term, right before you go to the real world, that teaches you about all of that stuff, or at least gives you like a rundown and gives you the idea of like, if you really don't know and you can't figure it out by trying to look through this stuff, or even asking your patient, maybe they know their coverage. I don't know, run up to the front and for a few seconds and just be like, hey, can you check on this for me really quick while I am doing this for this patient or something? I think it would have been really helpful to know that, or have our instructors give us a heads up on what we could expect in the real world, because it's a lot different than school. Like we had paper charts, we had, it's just a lot different. The sequence is different on how we do things, and you know what you know in school, and then you go there and you're like, I don't know what I'm doing. So it would just be nice to know what to expect and what we may see and run into, and maybe how we could change that, how we can bring it up with our doc and be like, hey, so I noticed this. I was wondering if we could change that to this. Nicole's doing a great job at that, but I obviously need a little help. So I wish I would have learned a little bit more about that, because I'm a nervous Nelly, like I said.
You get braver and braver every day, though. Just wait, Mia. You're going to be bossing people around in no time.
I hope so.
With every mistake comes more courage.
Yeah.
All right, Amanda, you want to ask our last question?
Yes. Okay. So I know it's only been 2 weeks, but what piece of advice do you wish you could go back and give yourself as a new grad?
That you're going to be fine. I would just say you're going to be fine. Like I promise, it seems really scary and really overwhelming, and you honestly might toy with the idea of quitting hygiene, but you can do it. You will survive.
I would say prepare, because that's just how I am, but I also feel like it's incredibly helpful. The leading up into my first couple of days, I made a sheet of all specific hygiene codes, all of the provider codes. I laminated everything. I mean, I made a clipboard. I even made like a very basic girl, like how to do a cleaning checklist, seat the patient in the chair. And I literally had boxes next to it. I never actually had to use that, but I was over prepared. I cleaned my room fully. I had everything stocked. And I feel like just having that was really very helpful for me to have everything ready to go. Because as I was trying to navigate the patient and the care I was providing, I didn't have to worry about all those other things. They were already ready to go. So I'd say over prepare.
But now do you guys see how she compliments me?
I love it. I love it so much.
You're going to be fine. Over prepare.
There is so much to over preparing, Nicole. Like I can speak to that, because it's not even just like about having the list. It's about just thinking through the process.
Right.
That really kind of puts you in that mindset. So the list is there, but it's the prep work that you've done beforehand that really puts you in the mindset. So I love the list. I'm a list person. So visuals.
Yep. Me too. That's how I am.
Okay, we're gonna have to do a follow-up to this podcast maybe next year. I don't know when, but just touch bases with you guys on how like that first year went. I guess we kind of want to track your guys' journey as
Oh, I would love that. That would
starting
be so
from
fun.
just stay connected. I want to thank you guys so much for joining us on the podcast tonight. It's been really fun, and it's really been eye-opening to think about like what these new grads are experiencing right now. Like, cut them some slack. And so
Yeah,
thank
we
you
all
guys.
feel like frauds. Be nice to us.
Thank you so much.